Hey guys, welcome to my first obstetrics video for PLAB, and I'm going to start out by talking about how antenatal care in the UK is administered by midwives till a disease, risk, or other need is identified. So at that point, you would be the patient would be under the care of an obstetrician. And at the first antenatal visit, and that should happen by the 12th week of gestation, it is important to ascertain a present, past, and family history of the following diseases: diabetes, hypertension, and mental illness. Now, diabetes, even if, and family history is really important in this case because the patient could not have any history of being diagnosed with diabetes, but if they have it in the family, the pregnant state can bring about glucose intolerance. So because of beta-HCG. Hypertension is particularly devastating, and that's something you really need to watch for because whether or not the patient is hypertensive before pregnancy, they can develop gestational hypertension and or preeclampsia, which are devastating both in terms of placental perfusion, but also devastating in terms of end organ damage to the patient. Mental illness, you really need to pay special attention to the patient's psychiatric history, especially because the drugs, the therapies and treatments for bipolar disease and schizophrenia can at times be teratogenic. So an assessment needs to be made of benefits and risks of certain drugs and whether it's worth continuing certain therapies. For patients born outside of the UK, you need to make note of the fact that there's increased incidence of heart disease, especially rheumatic heart disease, and also hemoglobinopathies. So, as compared to the native-born population. Unplanned pregnancy, or a partner not involved. In those cases, you need to kind of pay special attention to the fact that domestic abuse may be involved, and the patient might not come right out and say it. Every patient on the first antenatal visit gets these tests, and these are important, especially, there's physiological anemia of pregnancy, but the patient can have underlying anemia as well. So you need to make sure that this is addressed if there is anemia. Blood type, antibodies, important because you really don't want to have a hemolytic disease in the baby. And I will get into Rh positive, Rh negative, and that stuff in another video. Syphilis, rubella, HBsAg, and HIV are also tested in every woman, and urine specimen there is sometimes a predisposition to have urinary tract infection or pyelonephritis in pregnant women, but also what's important is proteinuria. So not only infection, but proteinuria, because that's a sign of end organ damage. In a certain subset of women, you're going to get a sickle cell test, hemoglobin electrophoresis, and that's if there's a history or you suspect that the baby or the mother may have sickle cell anemia. And in terms of the ultrasound scan, I will get in that in another video, but you know that you can start to visualize and perhaps even date a pregnancy by the 5th week of pregnancy on an ultrasound. However, it's not routinely done. The only time you do an early pregnancy scan, which is less than 11 weeks of gestation, that's a scan you do at less than 11 weeks of gestation. That is done in cases where you suspect a molar pregnancy or if you suspect multiple gestations. And I will get more into the ultrasound scan, of course, in another video. And at this first antenatal visit, you will also offer screening for chromosomal abnormalities, so you will talk to them about that. Thank you for watching my video. Please subscribe.